First trimester combined screening, which we will now call FTS, is a prenatal screening test available to all women between 11 and 13 weeks and 6 days of pregnancy. Choosing whether to have FTS is an important decision for pregnant women and their partners.
Women are faced with many decisions in their pregnancy, and some decisions are harder than others. The decision about prenatal testing can be quite a challenge. It's important that women and their partners understand what the test is for, what it can detect, what it can't detect, what are the consequences of testing, and what are the benefits to them. Many women find there are influences in their lives, and they have to take that into account when they're making decisions about testing. So what we're here for today is to provide you as much information as you can so that you can make a choice that is right for you.
What is first trimester combined screening, FTS? FTS is a prenatal screening test for chromosome conditions, such as Down syndrome, trisomy 18, and trisomy 13, and for some early detectable birth defects.
Down syndrome is a medical condition that's caused by the presence of an extra 21st chromosome. So in medical terms, also called trisomy 21, 3 chromosome 21s. The presence of that extra chromosome 21 during development results in a variety of physical and intellectual differences for these children. Medically, we'd say that there is an increased risk of certain problems like congenital heart defects, and hypothyroidism and needing glasses is more common for children with Down syndrome. But by and large, we consider them to be healthy and have a normal or very close to normal lifespan. The intellectual disability varies quite a bit from child to child, and generally we would say that there's mild to moderate intellectual disability. And the variability, though, remains unexplained, and there's no way to really predict at any stage, in particular in a newborn, what level of functioning they're going to achieve.
When considering the first trimester screen, I didn't hesitate. I thought it was important to know that the baby was okay, and though I knew little about the chances of having a Down syndrome baby, I wanted the reassurance that the baby was in place, that there was a heartbeat, and that it was a single pregnancy.
The question often arises is, what are the risk factors for having a child with Down syndrome? And essentially we answer that any couple can have a child with Down syndrome, that the problem that arises in packaging the extra chromosome that results in Down syndrome can happen to anyone. We do know, however, that one of the risk factors is maternal age. So, for example, if you take a 20-year-old, their risk of having a child with Down syndrome, a 20-year-old mother, that couple's risk of having a child with Down syndrome is going to be about 1 in 1,200. By the age of 35, it's going to be closer to 1 in 350. There's other chromosome differences, so there's trisomy 13 and 18, which are rarer than Down syndrome, but actually much more severe. So 3 chromosome 21s or 3 chromosome 13s or 3 chromosome 18s results in much more severe physical differences, and often the babies won't make it to the end of the pregnancy or will die shortly after delivery. So although chromosome differences can be relatively common, it's important to always remember that the majority of couples have healthy babies who don't have chromosome differences.
They sat down with us and they went through everything us before and then did the test, and then afterwards went through everything, told me sort of my risk factor walking in off the street and then my risk factor after getting the test. So I was really happy with everything for sure.
Now, what are birth defects? This is a physical condition that a baby is born with. Examples of birth defects include spina bifida, heart defects, and cleft lip. All women, regardless of their age, family, or previous pregnancy history, have a 2 to 3% chance of having a baby born with a birth defect. The 11 to 13 week ultrasound performed with the first trimester combined screen provides an early evaluation of the baby's physical development and may be able to detect some, but not all, serious birth defects. The recommended 18 to 20 week ultrasound allows for a more thorough evaluation as the baby is larger and development is more advanced.
Well, apart from giving me peace of mind of knowing that the test results were negative for Down syndrome, hearing the baby's heartbeat was ultimately a relief off of my shoulders. Initially, you don't get the first ultrasound until you're 18 to 22 weeks, so this gave me a little bit of reassurance 5 or 6 weeks in advance.
An understanding of the difference between prenatal screening and prenatal diagnostic tests is important. A screen is a test that provides you with risk information only. The FTS answers the question, How likely is it that my baby has Down syndrome? It does not give you a yes or no answer. Rather, it provides information specific to your pregnancy about your chance of having a baby with the Down syndrome. If your screen result places you at an increased risk, you will be offered a diagnostic test. Prenatal diagnostic tests answer the question, does my baby have Down syndrome? Prenatal diagnostic tests include chorionic villus sampling, which is usually performed between 11 and 13 weeks, and amniocentesis, which is performed after 15 weeks in pregnancy. These two tests provide you with a diagnosis that is a yes or no answer about chromosome conditions.
The results were great in a sense that, I walked in off the street as an average 39-year-old, my risk of Down was 1 in 90. And then after I did the blood test and then I did the transnuchal, my risk dropped to 1 in 1800 plus or something. So it was really low. But then, so you feel better about it, but you still know it's not 100%. And I think I'm one of those people that needs 100% to know for something like that. So it helped. And I know a lot of people with those kind of risk factors feel very comfortable with that. I actually opted for the amnio just because I wanted to go that extra step. So
let's review what you can expect from first trimester screening. FTS involves a maternal blood test and a special ultrasound of the baby called a nuchal translucency ultrasound, also known as the NT scan. Both are performed between 11 and 13 weeks 6 days in pregnancy. The maternal blood test measures two substances, PAP-A and free beta-HCG, which are normally found in the blood of all pregnant women. Pregnancies with Down syndrome and other chromosome problems often have levels of these two substances that are out of the expected range.
Normally, as I said, we'll do the measurements and then we'll ensure the baby's correct age. And we have to be between 11 and 14 weeks.
The NT scan measures the amount of fluid at the back of the baby's neck, called nuchal translucency. All babies have some fluid here, but in some pregnancies with chromosome conditions, this fluid tends to be increased. The ultrasound at this early stage in pregnancy is also used to confirm that the baby is alive, confirm the dates of the pregnancy, diagnose a multiple pregnancy, check for birth defects that may be visible this early in pregnancy. As this is a screening test, the results from the blood test and nuchal translucency ultrasound do not diagnose Down syndrome. Rather, the results provide you with risk information only.
I think a really important part of first trimester screening is that a woman undertakes the test in the context of informed choice, that she truly understands that although the test in the vast majority of cases provides peace of mind and is very reassuring, there is a small chance we might find a problem. And that can be a beneficial thing in most circumstances, allowing the obstetrician or the specialist to care for her pregnancy in the optimal fashion. She has to understand that that can definitely happen. Another thing that can happen is that we may falsely reassure her, which is an unfortunate but a not uncommon thing in screening, that a woman might have a completely normal test but still have an underlying problem. So it's important to know that, again, the difference between screening and diagnosis. And screening, 85 to 90% mean that 10 to 15% of the time we may provide reassurance inappropriately. Now, we do have ways to further refine that detection rate and improve it with subsequent tests.
Most babies are born very healthy, regardless of a woman's age, regardless of testing, regardless of a family history or previous pregnancies. Most babies are born very healthy.
I recommend going to the clinic and getting it done, and then making your own decision based on what information you get, and then you can decide for yourself.
Not only is it a reassurance for us, but I think it also gives parents choices early on in the pregnancy instead of waiting until they're almost too late to make a choice.
In summary, FTS is a risk assessment screening test available to all pregnant women. Having FTS is your choice. Prenatal genetic counselors can answer your questions and can be reached in Calgary at 403-943-8375.